Okay, so this is an example of a chain. And as I said, we can, our whole life is a chain. We learn in chains, right? Anything we've ever learned to do has happened in a chain. But this type of chain analysis is taking a discrete moment in time and pulling it apart so that we can help our patients understand what their experience is like in a context in a behavioral context. So we always start with vulnerabilities. And if we have a borderline patient, we know they have the vulnerabilities of high emotional sensitivity, high reactivity, and slow return to baseline. What are other vulnerabilities that impact anyone on a day-to-day basis in terms of being able to be effective in their job or effective in managing their emotions or having a life worth living? What are other vulnerabilities we face? Yeah. Yes, so she said physiological things like hunger, overwork, lack of sleep. Hanger is a real thing, people. I'm just going to share with you. It's a real thing. I have a patient that I see in our outpatient clinic, and I don't do a session with her without a snack ready for her, because when she's hungry, there's nothing therapeutic is going to occur in that room. So we do have vulnerabilities that impact our ability to be skillful in any given situation. And then we have our trigger or our event. And so does anybody have an example they want to use from a patient that you've worked with or something that someone has brought into session with you, or do you guys want me to continue making stuff up? I'm comfortable either way. Okay. So we're going to say that the trigger is, I'm going to give you guys a video to write down to watch. It's Katie Kaboom, K-A-T-I-E, and then Kaboom, K-A-B-O-O-M. And it's a video about a young teenager who, sprints down the stairs or skips down the stairs to tell her parents that she's been invited to the prom. And she goes on to say everything that's going to be involved in that, which is, I need a new dress, we'll have to have a limo, we'll have to have a motel room till morning. And the parents, of course, say, whoa, 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 we need to talk about this. And then she gets really big, okay? So the event is, she was excited and happy she had been invited to the prom. She tells her parents about all of the plans and that she needs their credit card, and that's actually when parents say no, that she needs their credit card. Parents say, whoa, wait a minute, no, we're going to have to talk about this, you're going to have a curfew, and she sort of explodes, okay? So in that description, what do you think that the event that preceded the explosion is? How would you describe that?
She just wanted her excitement validated.
Maybe she just wanted her excitement validated, okay. Okay. The event, that's the feeling. I think that would have been the primary emotion would be disappointed, right? But the event was they told her no. I mean, she's bursting with emotion about this thing that she's super excited with, and they're cutting her off at the knees. I mean, that's her experience of it, right? And so she gets no for an answer, right? Her primary emotion, as you said, is probably disappointment or sadness or even embarrassment. You don't want to be the only kid, and I hope she's not the only kid, but you don't want to be the only kid whose parent says you can't stay in a motel room overnight when you're 15 years old, right? And so the primary emotion is the emotion that makes sense. It's the emotion that if I pay attention to it and I soothe it and I allow it, I'm going to feel better really soon, much sooner than if I don't notice it, okay? But she has a lot of judgments about that now. What are some of her judgments, do you think? I'm sorry? My parents suck. Yep. I would say that's probably accurate.
They don't want me to have any fun.
They don't want me to have any fun.
No trust.
And that's what she says in the video. When you guys watch it, you never trust me. You never trust me. Okay? And so with that judgment, her secondary emotion, of course, is anger. Right. And in the video, it's a cartoon. It's actually pretty funny. She grows into this hairy green monster. Her clothes break off of her. She starts destroying the house. She's so big and tall. And the parents are hiding behind a couch with army helmets on, and they're calling 911, and they have this whole thing goes on. So she and her dad start to have a conversation about what the curfew is going to be. Okay, and she eventually comes back down in the video when you guys watch it. But what happens after she gets really big and is arguing with Dad, and in the video, Dad gives in. Dad says, okay, 2:30. He was staying strong at midnight. And then he finally says, okay, 2:30. What happens at the end of the chain for her? What comes from her getting really, really big? She got reinforced. That's what we would say behaviorally, right? She got what she wanted. By getting really big, I got relief, right? And so when we look at the chains of our patients, what we notice is that relief is often, if not always, at the end of these chains of cutting themselves, having thoughts of suicide, wanting to kill themselves. They need relief from that emotional pain, and that's valid. We would need relief too if we were in that much emotional pain. And I'm sure we've all had times in our lives when we were in that much emotional pain, when we lost someone close to us, when someone we loved died, right? These people live in that space all the time, okay? So they get relief from it, and that's really, really reinforcing. So whether Dad gave in or not, it is really not as important as getting really big gets her relief from her secondary emotion of anger. When we scream and yell and kick and hit something, we take, it's the pressure cookers, some pressure's taken off, right? And so we kind of come back down. So it's as much about that relief as getting what she wants, but both are actually true, right? So even if when parents stay strong, kids still often do these behaviors because A, it worked once or twice or 50,000 times, and they also get the relief, just the physical relief, from getting really big and yelling and screaming, or from cutting themselves. I mean, that's what really cutting is about, is relief, right? It relieves my emotional pain, even though it's only for this long. Because the minute they stop cutting and they get that relief, they experience an extreme amount of shame, right? Because they know people don't do this. This isn't adaptive. They know that, yeah.
They have a set script, so they're going to try to trigger that script so that they can go and get bigger and get to their relief.
I think that speaks to that they plan this and they get off on it.
Not really,
or
not the planning,
no.
But they're so used to using these behaviors. It's almost like a script, so they know, how to get bigger.
I think it's the only thing that has worked for them, and so of course they keep going back and using it again and again. So I guess I can agree with it in terms of that, absolutely.
Not saying they're...
Yeah, the manipulation thing. Right. Yeah, I think that probably would be accurate. And so what we know is that how many people have sat with your patients in a room and said, look at all these negative consequences that came from yelling and screaming at your parents. You were grounded, you lost video games, they're not going to let you drive the car for 5 years, right? And still, the next time they're dysregulated, they get big again. And that's because the relief that they get is so much more reinforcing than any negative consequence that comes after it. In that moment, even if they were to think of all those negative consequences, the relief that they've been conditioned to get, they've conditioned themselves, right? That this is how I get relief, is so strong. That connection is so strong that even all the consequences that come after it, which we know are a lot, aren't enough to help them break that chain. Yeah?
Do you mean both the relief that they get from the physical act of harming themselves as well as what happens in terms of the response cycle? Or do you just want to...
You mean the response cycle from parents? I think it's an and. So but what we know happens is, let's say if we had a meter that could gauge the intensity of the acting out behavior. if she acts out at a 7 and we give in, right? She's not going to start at a 2 or a 1. She's going to start at a 7 next time. And if we don't give in until 9, she's going to start at 9 next time, right? I mean, that's the learning that's happening. It takes me getting this big now to get what I want. So we're actually teaching, and they're learning instinctively and sometimes consciously as well. Does that make sense? Does that answer your question?
I think so. I guess
Okay.
I just was trying to determine if there's a separation, like that the learning process, but then also the physiological response to.
I really think it's and. I really do. Because remember the vice on our finger. If our vice is in an 8 or a 9, we're not really thinking about anything but getting it off, right? Our finger off, right? No anesthesia. I just, take it off, right? And so I think it's that both are accurate, for sure. So this is an example of a chain that we use at Willow Springs. We start out by helping our patients identify what their trigger or their event was. What we get often on our unit is, Cindy was a B, right? Or my therapist is a B. Primary emotion, right? They'll fill this out in whatever happenstance way. They just do it the quickest way that they can. But we get them into therapy, and then we get to say, so let's be more descriptive. Your therapist is a B is not very descriptive. What did I do? What did I say that led you to come to that judgment, right? So we want to be as descriptive as possible when we're talking about events that trigger our emotion, okay? The primary emotion is the adaptive emotion that makes sense. It's universal. We know that emotions are universal throughout all human beings, no matter where they are, how much media they've been exposed to, or whatever. A smile is a smile in every culture that ever existed, okay? Those are hardwired things. So the emotion that makes the most sense to the event that they had, we help them determine what that is. And they have a really hard time with that, because when we say, what was your primary emotion? Anger. And so what we know is that anger really isn't that adaptive as a primary emotion anymore, right? I mean, in our society, it's not that adaptive. When we were cavemen and had to keep people, out of our cave or whatever, we're beating off a saber-toothed tiger, probably more adaptive, not so adaptive anymore. So what we teach is that our 99.9% of the time, anger is going to be a secondary emotion. So we automatically put it in that secondary spot when they say it, okay? And then we help them figure out what makes sense, right? And then we help them figure out what their judgments are. And then that often leads to their behavior, right? Once I'm angry, I'm yelling, I'm screaming, I'm destroying things. Perhaps I'm an imploder instead of an exploder, and I'm self-harming, right? Or I'm plotting my next suicide attempt. And then what the consequences of that behavior were. And so what we do with our kids is we have under here skills I could have used. And so we give them cheaters or hints about skills they could have used in that place on the chain. So skills that are very effective when we first see a trigger, right? Or we first come upon something that we know is upsetting to us all the time, right? We give them an idea of what skills are effective if we can break it at the primary emotion, okay? So the idea is to help our patients break the chain somewhere so that they don't do the target behavior at the end, or the second event and action, which is usually the self-harm, the aggression, the school truancy, all of those things that they're coming into therapy for us about. And so that they can avoid those consequences. But we know that the relief that they get from that behavior is really, really strong. So consequences are not going to be the best way to motivate them to be able to try a skill. So what we often do is we will put contingencies in place. And so my cohort, Daniel, who often we present together from Willow, who's not here today, will say, Starbucks changes lives, okay? So we will put a contingency in place, right, that we will create a skill plan, and they'll actually go to staff and get it signed off on. They'll demonstrate skills. And if you fill up this skill plan, I'll bring you a Starbucks at the end of the week, right? And so that's, in order to motivate them to use skills outside of their emotion dysregulation, so they can become familiar with what that feels like, which ups the odds that they're going to be able to use it when they are distressed. Okay. So, so wherever we break the chain, and most of the time we have to start right before the behavior, right? Someone who lacks skills, whose go-to is self-harm or suicide or drugs or completely avoiding life in general, right? Won't go to school, doesn't socialize, all of those things. It's usually right before the behavior where we have to start to break it. And like I said earlier, they've usually white-knuckled their way through something, right? And it's usually associated with some contingency that we put in place, right? Whatever that is, a longer pass or just our praise and our connection. Those also we use as reinforcers as well. And then we talk about it after the fact, right? We're talking about it. We're saying, what if you would have thought about, what if it would have come to your brain to use self-soothe when you noticed that you were angry? We're just gonna go one step back from the behavior. What if you know your body cues for anger, you get hot, you clench your fists, you clench your jaw, and what if you had thought, if it had come to you, to use self-soothe? What do you think you could have self-soothed with in that moment? So we're putting ideas into their head. We're setting up plans for the future by helping them break their chain in all the different spots.